Sup, chooms, how y'all living? Hope everything is nova and you're all having a preem week. So, in the last couple of videos, we have been getting back to basics by going balls deep into the science behind finasteride dosing and the risk of side effects from finasteride. Of course, even though I am a finasteride user myself, and a proud one at that, I don't want to neglect my fellow hair loss witchers who consider themselves part of the Dutasteride master race. So today, we're going to do the same thing for the other 5-AR blocker. You know, the one that's not officially approved for the treatment of androgenetic alopecia. That's right, we're going to be talking about Dutasteride, or as Dr. Paul Saladino would say,
Dutasteride.
Now, it's not like Dutasteride isn't FDA approved at all. Like finasteride, it was originally FDA approved for the treatment of benign prostatic hypertrophy, also known as BPH, and this approval was in 2001. It turns out, though, that Phase 2 and Phase 3 studies were performed aiming towards FDA approval for the treatment of hair loss, and we'll look at these studies here, but for whatever reason, it never went through the formal approval process. Although it should be mentioned that Dutasteride is approved for the treatment of male pattern baldness in good Korea. Nevertheless, since it is already FDA approved for benign prostatic hypertrophy, Dutasteride is often used off-label for the treatment of androgenetic alopecia, and it is especially popular for the small number of people who do not get a good response to finasteride, since Dutasteride is considered by many to be the more potent drug. Unlike finasteride, Dutasteride is usually used at the same dose as the treatment for BPH, which is namely 0.5 milligrams per day. But that's a little strange because we know that finasteride works just as effectively for hair loss at just 1/5 of the finasteride dose used for BPH, which is 5 milligrams per day, or even at lower doses than that, like 0.2 or 0.5 milligrams per day. So we normally use finasteride for hair loss at 1 milligram per day or less, and we know this works about as well as 5 milligrams per day while possibly lowering the risk of side effects. And I went over the rationale for this finasteride dosing in a recent video that I'll link below. So why is Dutasteride at 0.5 milligrams per day considered the standard dose for treating both benign prostatic hypertrophy and hair loss? Do lower doses work as well? Also, what about higher doses like 2.5 milligrams per day? Would they be more effective than just the standard 0.5 milligrams per day dose? Well, let's take a look at the dose ranging studies that were done on Dutasteride and see how different doses of Dutasteride compared to finasteride in terms of both safety and efficacy. Before jumping into these studies, though, it's important to realize that Dutasteride isn't an equivalent drug to finasteride. Although they are both 5-AR enzyme blockers that block the conversion of testosterone into the trash hormone dihydrotestosterone, they don't have the same effect on the 5-AR enzyme. Finasteride predominantly blocks the type 2 5-AR isoenzyme, which is predominantly present in the hair follicles, while Dutasteride blocks both the type 1 5-AR isoenzyme, which is present in the sebaceous glands, and to a much less extent in the hair follicles, and it also blocks the type 2 isoenzyme, just like finasteride. They both have effects also on the type 3 isoenzyme as well, though Dutasteride blocks the type 3 isoenzyme much more than finasteride. But the role of this type 3 isoenzyme is not well known, so it is not often talked about in hair loss research, though it is widely distributed throughout the tissues of the body, so it might be important in reducing serum DHT. Although keep in mind, serum DHT in adult men is already very low, hence why DHT after puberty is active predominantly in just the skin, scalp, as well as the prostate, where it of course only does bad things like give us acne, enlarge our prostate, and of course cause hair loss, which is why I often consider it a trash hormone. But as far as the type 1 and type 2 isoenzymes go, Dutasteride is 3 times more powerful than finasteride in blocking the also important type 2 isoenzyme, and it is a full-blown 100 times more powerful than finasteride in blocking the type 1 isoenzyme. So Dutasteride lowers serum DHT over 90%, while finasteride lowers it 70%. They both lower scalp DHT in the range of 50 to 60% depending on the dosage, which we'll talk about in more detail shortly. One other very important difference is that finasteride has a much shorter half-life than Dutasteride. Finasteride remains in the blood for only about 6 to 8 hours, while Dutasteride has an immense half-life of 5 weeks. Now, that doesn't mean Dutasteride remains potent for 5 weeks, just that there will still be traces of it in your system 5 weeks after you take it. Now, despite the short half-life of finasteride, its effects on lowering DHT last longer than its half-life, so you can take finasteride daily or even 3 times per week without decreasing its effectiveness as a DHT blocker. That is one of the reasons why finasteride is probably a better treatment to start with first before Dutasteride Dutasteride when it comes to fighting hair loss, because if you are a poor responder to Finasteride, at least it gets out of your system quickly and you can then titrate. One of the concerns with Dutasteride is its much longer half-life, particularly if you develop side effects from it, since it is possible that, at least theoretically, the side effects could persist for several weeks, although it is important to remember that current research on both Finasteride and Dutasteride shows that both drugs are very well tolerated with a low incidence of side effects. So, like I mentioned before, even though Dutasteride never became FDA approved for hair loss, it came pretty close to it, at least, as there is a phase 2 and a phase 3 study on Dutasteride for the treatment of androgenetic alopecia, and in both of these studies, the investigators looked at different Dutasteride doses and then compared the results to using Finasteride. The first study was by Olson and was published in 2006. This was a multi-center randomized controlled study that enrolled men aged 21 to 45 years old with androgenetic alopecia. The Norwood scales were ranged from 3 to 5, and there were 416 men initially enrolled, and they were randomized to receive Dutasteride at doses of 0.05 milligrams, 0.1 milligrams, 0.5 milligrams, which is the standard dose for BPH, and they also measured doses as high as 2.5 milligrams per day, which is the equivalent of taking 5 Avodart capsules, which is the trade name for Dutasteride. They also randomized men to receive Finasteride at 5 milligrams per day, and also a placebo group who were given broccoli sprouts. Just kidding, it was probably just a sugar pill. Anyways, the study lasted for 24 weeks, and the primary endpoint of the study was hair counts in a 1-inch diameter circle of the scalp measured by macro photographs, which is the same thing as a phototrichogram, which is a tool that can measure exact hair counts. So it is more accurate than a photo assessment, although the researchers also looked at global photographs and investigator assessments, as well as subject self-assessments of their hair. They also measured serum testosterone and DHT levels throughout the study, and also 12 weeks after the study ended when the subjects were off medication, and then every 2 months after that until the DHT levels were back to normal. Finally, they did scalp biopsies and measured scalp testosterone and DHT at baseline, and then after 24 weeks of treatment. So what were the results? Well, as you can see in this graph here, all doses of both drugs were more effective in increasing hair counts than placebo, both at 12 weeks and after 24 weeks. So no surprise that Finasteride and Dutasteride both work. I think that very few people would argue that. In addition though, while the 0.1 milligram dose and 0.5 milligram doses of Dutasteride were comparable to or slightly better than 5 milligrams of Finasteride, the 2.5 milligram dose was significantly better than 5 milligrams of Finasteride at 12 and 24 weeks. The increase in hair counts at 24 weeks were 95 hairs on Dutasteride at 0.5 milligrams per day, 110 hairs on Dutasteride at 2.5 milligrams per day, and 76 hairs on Finasteride at 5 milligrams per day. The other endpoints showed basically the same results, which you can see here. On the left, you have a panel of experts rating global photographs at 12 and 24 weeks, and this showed the most improvement with Dutasteride at 2.5 milligrams per day. And on the right, you see similar results with the investigators' assessments of improvement when the subjects were seen in person. So it looks like the 2.5 milligram dose of Dutasteride is the very best, and doses of 0.1 milligram or more are at least comparable or possibly a little better than Finasteride, even at 5 milligrams per day, which again, I remind you, is 5 times higher than the standard dose for treating androgenetic alopecia. So let's go ahead and look at DHT suppression, both scalp and serum DHT suppression. This graph here shows serum DHT suppression with the different doses of the drugs. There was 70% serum DHT suppression with Dutasteride at 0.1 milligrams per day, 92% suppression with Dutasteride at 0.5 milligrams per day, and 96% suppression with Dutasteride at 2.5 milligrams per day. This compares with 70% suppression with Finasteride at 5 milligrams per day. So this shows just how potent Dutasteride is, being that even 0.1 milligrams of Dutasteride seems to be as powerful as 5 milligrams of Finasteride. Also, the researchers here measured serum testosterone levels, and as it turns out, testosterone rose in all the treatment groups, but more with Dutasteride. Dutasteride at 0.5 milligrams raised serum testosterone by 24%, and at 2.5 milligrams, it raised serum testosterone by 30%. Finasteride, on the other hand, had less of an effect, raising serum testosterone only 10%. Now, I know there are some people out there who think that testosterone causes hair loss, and therefore dutasteride raising testosterone by higher levels than finasteride is something we should be concerned about. I don't blame people for believing this. It's something I used to believe myself, but the good news is that there is no evidence that testosterone in the physiologic range affects hair loss. Keyword here being physiological though, meaning normal levels of testosterone. So, for example, a study of 373 men from northeastern Germany published in 2017 showed that there was no association between serum testosterone levels and the presence or absence of hair loss or the severity of hair loss. To quote this study, quote, "Total testosterone was not significantly associated with general hair loss or the Norwood-Hamilton scale," unquote. They also found no correlation between hair loss and free testosterone levels. So these increases in serum testosterone from dutasteride are in the normal physiological range and wouldn't be expected to worsen hair loss. And we know they don't worsen hair loss because both dutasteride and finasteride improve hair growth despite raising testosterone levels. Now, if we're talking about using testosterone as a performance-enhancing drug to get supraphysiological levels of testosterone, and you are not on a 5-AR blocker, you might end up raising your DHT, and that might lead to hair loss since higher testosterone is correlated with higher DHT, but these effects of 5-AR blockers on serum testosterone won't do that. So a 10 to 30% increase in serum testosterone really isn't all that much. I mean, it might be enough to raise your libido slightly, but it's not going to be comparable to taking steroids or testosterone for the sake of performance enhancement. I mean, that could easily quadruple your testosterone levels. But anyways, getting back to what happened to DHT levels specifically over time, serum DHT took a longer time to return to baseline with dutasteride than with finasteride. The DHT was back to baseline 12 weeks after stopping dutasteride at doses of 0.05 milligrams or 0.1 milligrams, or after stopping finasteride at 5 milligrams per day, but not with dutasteride at 0.5 milligrams or 2.5 milligrams per day. As the authors of the study say, quote, "Serum DHT returned to within 25% of baseline in a median of 86 days after treatment for the dutasteride 0.5 milligrams group and in a median of 155 days for dutasteride 2.5 milligram group," unquote. Of course, the big question about dutasteride is scalp DHT suppression. So, based on scalp biopsies, the suppression was 32% with dutasteride at 0.1 milligram, 51% with dutasteride at 0.5 milligrams, and 79% with dutasteride at 2.5 milligrams. With finasteride at 5 milligrams per day, the suppression of scalp DHT was 41%, so roughly between the 0.1 milligram and 0.5 milligram dutasteride doses. Now, even though the researchers here only looked at 5 milligrams of finasteride per day, we can safely assume that 1 milligram of finasteride likely suppresses the same amount of scalp DHT because there has been research comparing the efficacy of 1 milligram of finasteride versus 5 milligrams for hair loss, and it was found that both were equally as effective. But this video is about dutasteride, so if you want to know more about different doses for finasteride for hair loss, I'll go ahead and link that video I made about it below, but for the sake of argument, just assume that anything that applies to 5 milligrams of finasteride also applies to 1 milligram of finasteride. So, with finasteride and dutasteride, it was found that scalp testosterone also increased. For example, with dutasteride, scalp testosterone increased from 23% to a whopping 222% when going from 0.05 milligrams to 2.5 milligrams of dosing, while the increase in scalp testosterone on finasteride at 5 milligrams per day was only 23%. But again, the higher dose was associated with lower DHT levels and increased hair growth despite the increase in testosterone levels, which further demonstrates that testosterone by itself does not cause hair loss. So in the very rare circumstance where finasteride does not suppress enough DHT, the good news is that dutasteride suppresses more scalp DHT with increasing doses than finasteride does. In fact, finasteride seems to peak at 1 milligram for scalp DHT suppression, but dutasteride doesn't have this limitation, so even in the exceptionally rare circumstance where the standard 0.5 milligram dose of dutasteride isn't enough, a patient can go all the way up to 2.5 milligrams of dutasteride for even greater scalp DHT suppression. So since we're talking specifically about scalp biopsies and not just serum DHT suppression, some of the suppression of the scalp with dutasteride is probably from the type 1 isoenzyme, which is prevalent in the sebaceous glands of the scalp. This may not be relevant to the hair follicles though, which predominantly contain the type 2 5-AR isoenzyme, and based on the current data, it is not known if the type 1 isoenzyme plays any role role in hair loss. Remember though, that dutasteride is also a more potent blocker of the type 2 isoenzyme than finasteride, so that probably explains its greater potency in fighting hair loss. Anyways, the scalp DHT levels are more important than that of the serum DHT levels, because if you look at the scalp DHT suppression versus changes in hair count, there is an inverse correlation, meaning the more you suppress scalp DHT, the better the hair counts are, regardless of whether you're using finasteride or dutasteride. Finally, getting to the side effects, the good news here is that there were no statistically significant differences in the side effects in any treatment group as shown in this table. However, 9 men in the 2.5 milligram dutasteride group complained of decreased libido versus 1 in the 0.5 milligram dutasteride group, as well as 3 in the finasteride group. So there is at least a trend towards more sexual side effects on the highest dose of dutasteride compared to standard and lower doses. The risk of side effects are going to be low though, even if you are using 2.5 milligrams daily, but it stands to reason that using a 5 times greater than the standard dose likely puts you at least a slightly greater risk of developing sexual side effects. So, to summarize the study, dutasteride is more effective than finasteride in suppressing serum and scalp DHT, as well as reversing androgenetic alopecia, with finasteride at 5 milligrams a day being about equivalent to a dose between 0.1 and 0.5 milligrams per day of dutasteride. 2.5 milligrams per day of dutasteride is more effective, but it also seems like it has a more prolonged effect on decreasing DHT, which is a bit of a double-edged sword. On one hand, there is a concern that since it hangs around in the system for a long time, it therefore might take a long time for side effects to resolve on their own. The good news, though, is that by having a long half-life, it may be possible to take dutasteride just once or twice per week while using finasteride on the other days, and I know some doctors have prescribed regimens that center around incorporating dutasteride use alongside finasteride as a means of getting some of the increased potency benefits of dutasteride without having to use it every day, since you're using finasteride on those other days. Of course, nobody can predict how well you're going to respond to treatment, but the fact remains is that there is a lot of variability when it comes to utilizing 5-AR inhibitors as part of a hair loss prevention program. Anyways, based on the results of this study, a phase 3 study was designed, and this was published by Harcha in 2014. This was another randomized controlled trial, and it enrolled 917 men aged 20 to 50 years old with androgenetic alopecia who were Norwood scales ranging from 3 to 5. This time, they threw out the 2.5 milligram dutasteride doses, and maybe that's because there were concerns about prolonged side effects, and instead this time, they just looked at dutasteride doses of 0.02 milligrams, 0.1 milligrams, as well as the standard 0.5 milligram per day dose. Thankfully, this time they chose for comparison the standard dose of finasteride at 1 milligram per day, which at least gives us a familiar landmark. They also included a control group who were just taking placebo broccoli sprouts tablets. The primary endpoint was, again, like in the first study, hair counts measured by a phototrichogram, this time looking at circles on the scalp of 2.54 centimeters and 1.13 centimeter diameter. The secondary endpoints included hair growth, hair width, terminal hair count, and investigator evaluations of the subjects, as well as self-assessments by the subjects themselves. The results showed that dutasteride at 0.1 milligrams and at 0.5 milligrams, as well as finasteride at 1 milligram, were superior to placebo in increasing hair counts at 12 and 24 weeks, as you can see here. Also, dutasteride at 0.5 milligrams per day was superior to finasteride at 1 milligram per day. There were similar results looking at the other endpoints as well, including hair width and global photographic assessments. Adverse events were similar in the treatment groups, and there were no statistically significant differences between the active treatment groups and placebo in adverse events and withdrawals from the study. Looking specifically at sexual side effects, though, the overall incidence of sexual side effects was higher in the treatment groups compared to placebo, mostly due to a higher incidence of altered libido in the treatment groups, but there was no differences between the different drugs and doses in the incidence of these sides. So we can conclude that both finasteride and dutasteride have a very low incidence of side effects. So this study concludes that dutasteride at 0.5 milligrams per day is superior to finasteride at 1 milligram per day, and both are better than placebo, of course. The investigators felt that dutasteride was tolerated as well as finasteride, with some increased risk of sexual side effects versus placebo, but again, the risk for both drugs was very low. So let's go ahead and circle back to the review article I discussed in my last video and look more closely at the safety of dutasteride. This table compares 0.5 milligrams of dutasteride to placebo in various studies with high and moderate levels of evidence. Like the studies on finasteride I went over in my last video, there is a consistently higher level of sexual side effects with dutasteride compared to placebo, though remember, most of these studies are for the use of dutasteride in older men with benign prostatic hypertrophy, so you'd expect them to be at greater risk of sexual side effects to begin with since they're just older men. For example, the largest study, which is shown in the first row, is called the REDUCE study, and it included 6,729 men. It found an incidence of erectile dysfunction in 9% of men on dutasteride at 0.5 milligrams daily versus 5.7% on placebo, and reduced libido was seen in 3.3% on dutasteride versus 1.6% on placebo. The one study here that was a study of men with androgenetic alopecia, the study from Ewan, only included 148 men, and it found a 4.1% incidence of sexual dysfunction on dutasteride at 0.5 milligrams daily versus a 2.7% incidence in the placebo group. Of the studies that compare dutasteride to finasteride, we have gone over two of them already, the Olson study and the Harcha study. The first study in the table, the Andriol study, found similar incidences of impotence, decreased libido, and ejaculation disorder for dutasteride at 0.5 milligrams per day versus finasteride at 5 milligrams per day, but this was a study of men being treated for BPH. Anyways, in the study, there was no significant differences in sexual side effects between dutasteride and finasteride. Finally, we have the Kaplan study, which is the last study in this table. This study again looked at BPH patients treated with finasteride at 5 milligrams per day and dutasteride at 0.5 milligrams per day. This study included 378 men. This study, unlike the others, did find more sexual side effects with dutasteride than finasteride though. The incidence of erectile dysfunction was 5.1% with dutasteride versus 2.1% with finasteride. The incidence of ejaculatory dysfunction was 2.4% with dutasteride and 1.8% with finasteride. And the incidence of decreased libido was 2.7% with dutasteride and only 1.4% with finasteride. These differences were statistically significant, so this study contradicts the other studies that showed no difference in the incidence of side effects between dutasteride and finasteride, though this study is the smallest of all the studies that compare the two drugs, so maybe we have to take this one with a little bit of a grain of salt. So, after looking at all this data, we can probably assume that at the very worst, dutasteride only has a slightly higher risk of side effects than finasteride. But considering how low the risk of side effects from finasteride already are, there really is no harm in trying either drug. Both will work very well for hair loss, and both have a very low risk of side effects. With that being said, based on the existing research at least, it does look like dutasteride is the more potent drug in fighting androgenic alopecia compared to finasteride. It suppresses more serum and scalp DHT than finasteride, and that results in better hair growth overall. However, I still think that finasteride is a better drug to start with, because unlike dutasteride, you can't easily titrate below 0.5 milligrams because dutasteride is a soft gel, unlike finasteride, which is a tablet that can be easily halved or quartered. So finasteride gives users more variability with titration, which is especially useful if you don't respond well to the standard dose. Also, finasteride does have more long-term research in terms of its safety and efficacy, and it has been shown that finasteride continues to give benefits even after 10 years of use. So I prefer finasteride as I feel more comfortable with it as a long-term treatment. Also, even if dutasteride is a more powerful drug overall, finasteride is absolutely still a very effective, clinically proven treatment that will work well in the overwhelming majority of people who use it. Dutasteride is a good choice for the small number of people who don't respond well to finasteride, but for most of us, finasteride is absolutely good enough, and there is no reason to kill an imp with the BFG 9000 when the plasma gun is plenty good enough. It is definitely reassuring to know, though, that if for some reason finasteride isn't good enough, you can always try dutasteride at 0.5 milligrams per day, and if for some reason that's not strong enough, you can titrate it all the way up to 2.5 milligrams per day to get even more scalp and serum DHT suppression, and it doesn't even look like the risk of side effects is that much higher, so it's a good choice for people who have extremely aggressive androgenic alopecia where even finasteride isn't strong enough. One potential concern some people may have, though, is that since we know finasteride and dutasteride both metabolize through the hepatic pathway and could thus cause increased liver enzymes, a lot of people wonder if using higher doses of dutasteride like this could potentially cause liver issues. Well, fortunately, there have been no clinical reports of liver injury due to dutasteride or finasteride use, and they are both classified as a level E drug, which means they are unlikely to cause clinically apparent liver injury. Of course, if you have pre-existing liver issues, then your dose may need to be adjusted by your physician, or this therapy may not be appropriate for you at all. Other than that, though, all the data suggests that 5-AR inhibitors are the best and safest treatment we have in the good fight against androgenetic alopecia. And whether you choose to use finasteride, dutasteride, or even some combination of both, you can rest assured you're doing the absolute best thing you can possibly do to save your hair from the slaphead curse, and that is absolutely commendable. And with that, I wish everybody a happy Thanksgiving. I hope you all enjoy eating your vegan tofurkeys with your friends and family, and I'll see you all next time. Take care.